Hi, everyone. My name is Dr. Thalia Robakis. I'm a reproductive psychiatrist at Mount Sinai School of Medicine. So I take care of um, pregnant women and new moms with mental health concerns. And I'm here today to talk to you about mental health for new moms in the pandemic. So, first question is, what impact can mom's mental health during and after pregnancy have on the baby? So definitely mom's mental health can have very broad and lasting impacts on the baby, and this is true for both before and after pregnancy. So we know that active depression and anxiety during pregnancy are associated with worse obstetric outcomes for the baby, so they can shorten the term of the pregnancy. The risk for a C-section or an instrumental delivery seems to be increased if mom had a psychiatric episode during her pregnancy. Baby seems to be at higher risk of NICU admission if mom was actively psychiatrically ill during pregnancy. And we also do see some longer term behavioral outcomes in infants and toddlers and even preschoolers, like increases in internalizing and externalizing behaviors for children of moms who were depressed, anxious, or had other mental health problems, especially in pregnancy, but also postpartum. The good news is we do know that moms and babies both do better when mom is treated. And we also know that time limited periods of depression or anxiety, they don't seem to leave a lasting impact if mom's mental health improves and remains good for most of the early childhood. So it's not like if you have a time limited episode that you should be, terrified that there's going to be some long lasting effect. But if you are suffering, then, do get help because it's completely treatable. So next question is, has anxiety or depression amongst pregnant women and new moms increased during the COVID-19 pandemic? So I think anxiety and depression have increased amongst everyone in the COVID-19 pandemic. But it's definitely true that people who are expanding their families need tons and tons of support because taking care of a newborn is really not a job for just one or two people. So usually people are calling in supports from their family and their friends. But those types of supports people would normally expect to marshal when they have a baby on the way, they really evaporated during COVID-19. So, in addition to worries about possibly becoming ill with this new disease, where we knew initially very little about the long term implications, either for pregnant women or for their children, in addition to that, new moms have been dealing with isolation and either total loss or just really severe disruption of their normal support systems. So that all was extremely stressful and certainly has contributed to worsening mental health in this population for sure. So third question, can medication help maintain mood stability in women during pregnancy, and is it safe? So absolutely, there are many medications that are safe for use in pregnancy that we use. There are a few that we avoid, either because we already know that they're associated with some kind of problematic outcome, or some of them just because they haven't been well studied enough yet. But we do have many, many options for psychiatric treatment that have been extremely well studied for use in pregnant women. And this includes long-term follow-up of children who were exposed in utero. So for many of the most commonly used psychotropic medications, we have behavioral, cognitive, developmental data from people, through childhood and even now early adulthood who were exposed before they were born through their mothers. And these data are mostly very reassuring. And, the children look very good. They look very comparable to, comparison children who were not exposed to these medications. So there are absolutely very safe and well-studied options for use in pregnancy. Absolutely. And fourth question, why is it important for a pregnant woman to seek guidance from someone trained in medication management during pregnancy? So this is a very rapidly changing field with new information coming out all the time. And additionally, the information can sometimes be hard to interpret for people who may be experts in psychiatry but aren't already familiar with this specific field. So most general psychiatrists don't get specialized training in reproductive psychiatry in their residencies. And then as a consequence, a lot of them don't necessarily have the most updated information about which medications are safe and appropriate and which are best avoided. And it's often not something that you can figure out by reading quickly on your own around one or two medications that your patient is taking, because it's really a lot of information, and there are new papers coming out all the time, and the information changes. So for that reason, it's really ideal for anybody who routinely takes psychotropic medication and is thinking about trying to conceive to have at least a one-time consultation with a trained reproductive psychiatrist to identify a safe and appropriate plan for mental health care in pregnancy. And the best time to do this is before you stop your birth control, because ideally you want to head into the pregnancy with stable mood and a solid plan for what you're going to do. So for all those reasons, we absolutely want to see people before they even conceive. Mm-hmm.